Welcome back to the Med Simplified platform. We are diving right into part 2 of our upper limb explainer. So, if you were with us for part 1, you know we kicked things off up at the shoulder. Well, today, we're taking a fascinating trip down the arm, starting right from the elbow and going all the way down to the very tips of your fingers.
Specifically, we're going to focus intensely on the radius, the ulna, the wrist, and the hand bones. It's a lot of moving parts, I know, but our goal here is to help you easily grasp, pun totally intended, and master this complex skeletal puzzle. We're going to map the whole thing out step by step so you can easily visualize the framework of your own arm.
Here is a quick look at our roadmap. We'll follow a distal path today, starting with the forearm's dynamic duo, then breaking down the tricky carpal bones of the wrist, mapping out the hand, and finally, looking at the intricate joints that make it all move.
Okay, Section 1, the forearm, radius, and ulna. Let's dive right into this parallel track.
Seriously, take a second and look at your own arm right now. Beneath the skin, connecting your elbow down to your wrist, you've got these two prominent bones, the radius and the ulna. And when your arm is in standard anatomical position, which just means your palm is facing forward, these two distinct bones run perfectly parallel to each other.
Now, the tricky part is knowing how to intuitively tell them apart, right? It really just comes down to size and placement. The ulna is actually the longer bone of the two, and it sits medially, meaning it runs closer to your body. The radius is over on the lateral side. A super easy mental shortcut for this, just follow your thumb down. The thumb side is always the radius side.
And keep in mind, these bones aren't just floating next to each other in empty space. They are tightly bonded by what's called the interosseous membrane. Think of this fibrous joint as a highly specialized, flexible anatomical glue running right between their shafts. It's absolutely vital, because it holds them in place and stabilizes the whole setup against the immense forces we generate whenever we use our elbows or wrists.
Up at the proximal end, this is where they meet the humerus to form the elbow. From the front, the anterior view, you've got the humerus featuring the capitulum meeting the radial head and the trochlea lining up perfectly with the trochlear notch of the ulna. But if you spin it around to the posterior view, you'll see the olecranon process of the ulna literally hooking right in to securely form that classic elbow hinge. It's a brilliant mechanical design.
Moving on to Section 2, the carpal bones puzzle. Let's travel distally past the forearm.
We've hit the human wrist, which is an absolute marvel of natural engineering. It relies on exactly 8 carpal bones. Just 8. They fit together so tightly, kind of like cobblestones, and they're locked firmly into position by a dense network of ligaments. This setup gives us a very limited but incredibly precise range of motion.
To actually make sense of this cluster, you have to break it down. These 8 small bones are neatly arranged into 2 distinct rows of 4. You've got your proximal row sitting closest to your arm and a distal row positioned closest to your fingers. And we always organize and name them from the outside inwards, so lateral to medial.
And of course, we have a classic Med Simplified mnemonic to lock this in. From lateral to medial. She looks too pretty, try to catch her. Let's walk through it together. Proximal row first. She is scaphoid. Looks is lunate. 2 is triquetrum. And pretty is pisiform. Then moving to the distal row. Tri is trapezium. 2 is trapezoid. Catch is capitate. And her is hamate. Memorize that phrase, and I promise, that complex puzzle becomes completely manageable.
All right, Section 3, hands, metacarpals, and phalanges. Let's see how this builds outwards.
Spatially mapping the hand outwards gives us a really clear structural timeline. We progress from those carpals we just learned at the base of the wrist, flow right through the metacarpals that form the middle of your hand, and finally terminate at the phalanges out at the absolute distal tips of your digits.
Take a look at your palm. Right under the tissue there are your 5 metacarpal bones. They articulate securely with the carpal bones at their proximal ends. And just like the wrist, we use a specific numbering system here. They are numbered sequentially starting from the thumb side inwards. So, metacarpal number 1, that's the one supporting your thumb.
Now inspect your fingers. If you count them out structurally, you actually possess exactly 14 phalanges. Wait, how does that math work across 5 digits? Well, you have 3 in each standard finger, a proximal, a middle, and a distal phalanx. But your thumb, it only has 2. Those 14 tiny bones articulate with the metacarpals and with each other to build the entire framework of your fingers.
Finally, Section 4, Joints of the Human Hand. Let's tie it all together and see how they move. To synthesize all this, we need to look at how these 14 phalanges and 5 metacarpals actually articulate. Check out this striking color-coded view. At the base, connecting to the wrist, you have the carpo-metacarpal joint. Moving out to where your palm meets your fingers are the metacarpophalangeal or MCP joints. Further distally in the fingers, we have the proximal interphalangeal joints, or PIPs, and the distal interphalangeal joints, the DIPs. And remember, the thumb only features a single interphalangeal joint since it only has those 2 phalanges.
So as we wrap up part 2 here on the Med Simplified platform, I want to leave you with a bit of a mic drop question. Considering the massive complexity of everything we just explored, from that parallel track of the radius and ulna, through that crazy 8-bone carpal puzzle, right out to those 14 beautifully aligned phalanges, what is it about the specific articulation of these joints that truly makes human hand dexterity so unique? Think about that seamless structural masterpiece the next time you pick up a cup of coffee or send a text message. Thanks for joining me on this explainer, and keep questioning how the human body works.